The 6Cs are the qualities a service provider must have to inform and deliver person-centered values. The 6Cs are care, compassion, competence, communication, courage, and commitment. For the exam, you need to know examples of how service practitioners use the 6Cs to inform and deliver person-centered values. Service providers must provide high-quality, individualized care that addresses the service user's needs. They need to ensure their care is paramount by having service users' needs and preferences at heart to improve or maintain their well-being. They must also take time to do things in the service user's way. For example, a care worker in a residential home notices that a resident prefers to have breakfast later in the morning. They adjust the care plan to respect this choice, ensuring that care is based on the individual's personal preferences and needs, not just a routine. Compassion means understanding the emotional needs of individuals and responding to them with empathy and kindness. To do this, care for them and make them feel comfortable. Utilize active listening to hear their needs and what is troubling them. Provide emotional support by being there for them and reassuring them, and speak to them calmly. For example, a care assistant working in a hospital takes the time to comfort a nervous patient before surgery. They listen to the patient's fear, providing emotional support by sitting with them and speaking calmly. Not only does this show compassion, but it also helps to reduce the patient's anxiety. Competence means having the skills, knowledge, and ability to deliver safe, effective care. We can do this by providing the right care and support, by carefully assessing situations to understand and address service users' needs, and by being a reflective practitioner. A reflective practitioner is someone who looks back at their practice to improve the quality of care they provide, to effectively meet service users' PIE's needs. Service providers can also show competence in their roles by staying up to date with best practices, following ethical guidelines, and keeping up to date with training. For example, a healthcare assistant working in a GP surgery continually updates their training on administering vaccinations, so they can safely and competently provide this service to patients. By maintaining their competence, they ensure that care is delivered safely and effectively, meeting professional standards. Communication means engaging in a clear, open, and respectful dialogue to ensure that the individual's needs are understood and met. We'll look at effective communication in a later video. When communicating with service users, don't be patronizing. Use simple, non-technical language to ensure they understand the information you're trying to communicate. Additionally, avoid jargon and, if necessary, repeat or rephrase things to make them clearer. In the case service users are unable to speak for themselves, service providers must offer an independent advocate. Additionally, make them feel empowered to make informed decisions about their care, and have an open dialogue with them by involving them in the conversation. This could be by asking them questions. For example, a social worker uses simple language to explain a complex care plan to a service user with learning difficulties. They check that the service user understands what they are saying by encouraging questions and repeating information when needed. This open communication ensures that the individual is fully informed and can participate in decisions about their care, making them feel empowered. Courage is the ability to speak up and advocate for someone's best interests, even when it's difficult. For example, if you see a service user being ignored or neglected, make sure you speak up about it on their behalf. Don't be afraid to challenge other healthcare professionals. Make a complaint if your colleagues aren't ensuring their needs are met, or protect their rights. And lastly, they need to ensure they receive the care and attention they deserve. For example, a nurse notices that an elderly patient in a hospital ward is being ignored by other staff when they ask for help. The nurse speaks up on the patient's behalf, ensuring their needs are met, even though it may be uncomfortable to challenge their colleagues. This courageous act protects the individual's rights and ensures they receive the attention they deserve. Commitment is the dedication to provide high-quality care consistently and continuously. In order to show commitment, service providers must show ongoing dedication, understand their responsibilities, and need to be proactive. To do this, it's important to address concerns and problems early, to prevent issues from arising. Additionally, they need to ensure service users receive the best possible care. This builds trust and confidence and fosters a consistent relationship between the two parties. For example, A healthcare provider working with a long-term patient with a chronic illness stays committed to regular check-ins, adjusting treatment plans as the patient's condition changes. This ongoing dedication helps ensure that the patient continues to receive the best possible care over time, fostering trust and consistency in the relationship.